Imagine belonging to a large extended family knowing that half your relatives will die in their mid-40s. And worse, that you could be next in line for this strange disease that's ravaged your family for hundreds of years. With no cure, your only option is to go through life wondering if the illness will finally come for you. Sounds like a nightmare, right? And yet, this isn't the plot of a dystopian novel. It's a reality for over 5,000 residents of small mountain villages called hamlets surrounding Medellin, the second largest city in Colombia.
Researchers did a lot of work to try and understand in the 90s and early 2000s how this disease even got there, because it was understood to them from interviews that it was very old, that it had been there a very, very long time in these rural farming communities. And there were certain characteristics of the people that really got the researchers' attention. I mean, there were these giant Catholic conservative families. They also tended to be white people. The assumption was that this probably came from sort of a Spanish colonist.
That's Jenny Aaron Smith, author of Valley of Forgetting, Alzheimer's Families and the Search for a Cure. In the 1980s, researchers finally discovered that the mysterious illness plaguing this community was Alzheimer's disease.
They had been suffering with this terrible illness for hundreds of years. It was blamed on witchcraft. It was blamed on evil priests who cursed, women. It was based on all kinds of crazy rumors. And families had to live with that for a very long time, and a stigma.
It was just 40 years ago that these hamlets finally got some answers. A Colombian neurologist by the name of Francisco Lopera, working at Medellin Clinic, identified the disease as Alzheimer's.
He began treating farmers who were coming into his clinic. It was a public hospital clinic with dementia in their 40s. Early Alzheimer's cases were in the literature, but Dr. Lopera and his colleagues weren't terribly familiar with them. But what they did that was important was they went out to those farming communities, up in the mountains, hours away from Medellin. And at the time, it was very difficult to get to those communities. You had to take a horse. They discovered in those tiny hamlets more cases and histories of people who had ended up in the public mental hospital in Medellin, which is where many rural people took people and their families with mental illness and dementia.
Lopera quickly realized that he was dealing with something much bigger than a handful of dementia cases. He started collecting family health histories and created vast genealogies showing that all these people were related to one another. He also collected blood samples and found something very unusual. The people who got dementia all carried a single genetic mutation unique to that area. It's the same mutation researchers believe came from a Spanish conquistador centuries ago.
The gene wasn't known until the mid-90s. The gene on which this mutation occurs is called the presenilin gene. And these families had a unique mutation, a mutation unique to them, that came to be known as the PISA mutation. The type of mutation is called an autosomal dominant mutation. And so all that means is that it's not on a sex-linked chromosome. So it can go from a parent to a child of either sex, right? And generally the odds are 50% for each person born of a person with the mutation to inherit that mutation. So 50% of the children of affected adults would get the disease in their 40s.
With further research, Lopera realized that this gene mutation affected the production of a protein called amyloid beta. One feature researchers believe to be a key part of Alzheimer's is the buildup of plaque in the brain caused by this protein.
The amyloid hypothesis holds that amyloid beta, which is the first brain protein to emerge in Alzheimer's disease, it is responsible sort of for the cascade of neurodegeneration that occurs later and causes all the symptoms. What was interesting about the early onset Alzheimer's disease families is that, their brains could be studied as well because people donated their brains when they died. And Dr. Lopera was very clever in how he got people to donate those brains. And what could be seen then was how amyloid protein really flooded the brains of these individuals and how that particular genetic mutation acted to spark the overproduction of amyloid in their brains. So those were very important observations.
By the 1990s, Lopera's work had garnered the attention of other Alzheimer's researchers and also pharmaceutical companies. In partnering with Lopera, their goal was to create an anti-amyloid drug that would prevent plaque buildup in the brain of patients. In their eyes, his clinic was the perfect testing ground. For 8 years, members of this extended Colombian family participated in clinical trials, hoping for a cure.
They were well aware at the start of that trial that a lot of hopes rested on them, and that they weren't just doing it for themselves, but they were doing it to help solve global Alzheimer's disease. So I think, the heartbreak was on a personal level, but it was on a bigger level than that, because ultimately you could argue that this population of people who didn't have amyloid in their brains when they started the drug, when they started the trial, many of them didn't have any evidence of amyloid in their brains, didn't have symptoms when they started the trial, were the ideal people in whom to test this class of drugs, and it didn't work in them.
Along with the trial participants, this failed drug test dashed the hopes of many other researchers and patients. However, scientists now question if they put all their eggs in the wrong basket.
So the question was, maybe did the early onset Alzheimer's families sort of, on some level, steer the field to an overemphasis on amyloid protein in the brain, where there might have been many other things also going on in Alzheimer's brains? One of the concerns with Alzheimer's disease in recent years, with all the drugs that are the new drugs available on the market essentially being developed based on the amyloid hypothesis, they are anti-amyloid drugs. The question is, was familial early onset Alzheimer's, right? Alzheimer's that's caused by a genetic mutation in a certain gene and it hits you at age about 45. Was it and does it remain a good model for studying all Alzheimer's disease?
A potential answer to this question could lie in the same Colombian families. Illyria is a 76-year-old woman from the extended family who also has the same mutated gene, only she has no dementia. Researchers ignored her at first, thinking she was simply an outlier. But when the anti-amyloid drugs failed, they flew Illyria out to Boston to take a second look.
There at Harvard, she got all kinds of advanced imaging, and they could see something really fascinating, which was that Illyria's very functional brain, I might add, was full of amyloid protein, full of it, like a humongous load of amyloid plaques. And yet she really didn't have very much tau protein. Tau protein is the second protein seen in Alzheimer's disease, and it corresponds more, it's responsible for the tangled neurons that are a hallmark of the disease. And it correlates more closely to symptoms. So the more tau you have, or the sooner you have it, the more likely you are to have symptoms.
Researchers attributed her resistance to yet another mutated gene, this one affecting the tau protein.
That started the search for more genes like that might be able to blunt the effects of these terrible genetic mutations and genetic factors that could be protective and that maybe you could develop drugs based on.
A theory scientists are still working on. While Smith's book documents research that didn't pan out, it's an important reminder that finding a cure for any disease is a long and winding road. Her book, Valley of Forgetting: Alzheimer's Families and the Search for a Cure, is available now at bookstores and online. You can learn more about Jenny Aaron Smith and all of our guests by visiting our website, radiohealthjournal.org. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.